And more children have been hospitalized due to C-19. But here's something else to consider. Sometimes a child can be infected but not show symptoms until much later.
Our investigative reporter, Brendan Kirby, spoke with the Mobile couple. Their 11-year-old son came down with this virus. But Brendan, they say they didn't even know about it until a month later.
Yeah, that's right, Lanice and Byron. He was completely asymptomatic, but the complication that it caused was anything but. He ended up spending more than 10 days in the hospital, including 7 in the pediatric intensive care unit. When Reese Holloway got sick in August, his parents got him a COVID-19 test. It was negative, but his symptoms persisted: stomachache, fever, headache, and eventually a rash. So his parents took him to the emergency room and got a scary diagnosis: multi-symptom inflammatory syndrome in children, or MISC. Tests confirmed Reese had the antibodies, indicating that he had had the virus in the past. So what's it been like battling all this?
Very strange. Confusing and strange.
Scary.
Definitely scary.
MISC is a rare but serious side effect that can show up 3 weeks after a COVID infection. Dr. Benjamin Estrada, director of the Division of Pediatric Infectious Diseases at the University of South Alabama, says it can affect the heart and cause blood clots. For unknown reasons, he says, the virus sometimes triggers an overresponse from the immune system, which then turns against the body.
It affects multiple organ systems. We had not seen this condition before COVID. It's something new for us. It's potentially fatal.
It's also becoming more common. Dr. Estrada says the USA health system saw about 40 cases in the first 12 months of the pandemic, and about the same number in just the last 2.5 months. Reese's parents say they'd never heard of this side effect and felt blindsided. Shayla Barnes Holloway says she wants other parents to know.
What I say to most parents now is, during COVID times, as I like to call them, a stomach virus is just not a stomach virus.
Joseph Holloway says his son will have to avoid physical activity and be monitored for months, perhaps a year.
It's taken an emotional toll on him as well. One of the things that he came and mentioned earlier, he was asking and was in tears, am I ever going to get back to normal?
One of the scariest things about this is that experts just don't know if this condition can cause permanent damage. But Dr. Estrada tells me that most kids do recover from the acute symptoms. Reporting live in Mobile, Brendan Kirby, Fox 10 News.